Thank you so much, Dr. Sumisha. You gave here a wonderful session in this platform. We have get a lot of information from your valuable session. Now we are going to our international session by English language. Then good morning and good afternoon, good evening to all my beloved doctors and homeopathic lovers. Now we are gathering together to attend our 1544th day session conducted by International Forum for Promoting Homeopathy. This is our 1 hour session. After this session, our Malayalam webinar will be started at 9:30 to 10:30. First of all, I introduce myself. My name is Shalu Rajan from India and also our steering committee member. Today is our session's moderator. Before this session, we want to take a 1-minute silent prayer. Please be silent, dears. Okay, then today's our guest is our beloved Dr. Beatrix Gessner from Germany. She has been practicing homeopathy since 32 years and running her own clinic since 29 years. She has been giving so many seminars in Portugal since 10 years. Dr. Beatrix is specializing in dermatology, pediatrics, and general medicine. She has been with us since the beginning of Ifph. Today she is again here with us and will take to us on the subject of homeopathic treatment for skin disorders, part 7. She has came in this platform many times and shared a lot of her experience here. Today, we are eagerly waiting for her valuable words. Now, we warmly welcome to our beloved doctor, Beatrix Gessner, to this platform. Welcome, doctor.
Yes, thank you very much. Good evening, good morning, hello, and I'm happy to be with you today. We don't know each other so much, and Dr. Shalu, and thank you very much for your nice introduction. Today, we will go on with dermatological cases, and well, shall I share my screen or?
Madam, are you sharing the screen?
Yes, I'm sharing the screen.
Okay.
Yes, do you see the screen, Dr. Shalu?
Yes, it's visible.
Okay, so many greetings from Germany, and first of all, I would like to give you a nice impression of today. We have the first day of snow here, and it's always something very special for us in Germany, and I'm happy to share that impression with you. It's just 5 minutes from my place where I'm living. So many greetings to India, and let us start with the presentation. First of all, I would like to introduce a bit the functions of the skin, because the skin is a very, very interesting organ. It's multifunctional, and let's have some words about these. Skin is the largest organ in the body. It's nearly 2 square meters, and every 28 days, the cells of the epidermis are totally renewed. If this process is accelerated, we can see horny skin modifications like psoriasis. So if you see the skin anatomy, we have on the left, you can see the epidermis, the dermis, and the subcutis. So we have that 3 layers, and the epidermis is the frontier to the outside world, which is very, very important. And in the dermis, we have a lot of different kind of organs. We have the fat, we have the nerves, we have the blood vessels, and we have also the basics of our hair growing through the skin. So as we talk about the functions of the skin, it is an excretory organ. It's responsible for perspiration, for discharges. It's also an immune organ. That means it's IgE transmitted and also activating the mast cells as a defense of the body. And it's also a contact organ. We can feel with our skin, we can feel the heat, we can feel the warmth, we can feel pleasant sensations or unpleasant sensations. So the skin is protecting us in many different ways. It's a very intelligent organ. So something also very interesting for me was that when the little embryo is growing in the womb of the mother, we have 3 layers: ectoderm, mesoderm, and endoderm. And interesting enough, of course, the skin is the ectoderm, but also the brain comes from the outside layer and is folding inside as a brain and is part of the ectoderm. So that's also a reason why we see by experience that many skin conditions, especially eczemas or allergic skin conditions, are triggered by emotional and mental factors. So the psychological part of skin diseases is very prominent. And we also can see that in the word neurodermatitis. Here, our homeopathic remedies are the first choice because they cover the physical and the emotional sphere. And the skin is also a reflection of the soul. And also it shows health or lack of health. If we, as medical doctors, we look in the face of the patient, we feel whether he's looking well or not. That's the first impression. And that is transmitted through the color of the skin. So sorry, I will stop this here. In Europe or in Germany, allergic diseases are like a modern pandemic. We have a lot. The incidence of allergic eczema in Germany is about 15%. And the incidence of atopic diseases between 20 and 30%. So a lot of people are suffering from allergic diseases, food allergies, pollen allergies. And so often they try with nutrition and other possibilities. And the most important point in the whole treatment, and I'm treating skin disorders since more or less 35 years, 30 years in my own practice with homeopathy, and 5 years or 3 years I was working in a dermatological hospital in our capital in Berlin. So for our homeopathic treatments, the most important point is no suppression. And this was also the message Dr. Hahnemann gave to us. Because in his times, there was a lot of suppression with the syphilis, with the gonorrhea. So he could study these diseases. And he found out also the treatment in his time of the syphilis, treating the first affection in normally in the genital region, treating with mercury or strong other drugs, was making the body much more sick. So nowadays we are having more elegant methods. Our, let's say our suppression method, it's called cortisone. So many children get cortisone, and we see that disease can go from the outside layer, the skin, to the inner organs, like the lungs or the intestines. So in homeopathy, we also have that rubrics, asthma eruptions after suppressed. We have remedies like arsenicum, soranum, sulfur, also pulsatilla. And we have that interesting rubric, asthma alternating with skin eruptions, also arsenicum, medsarium, soranum sulfur. So these rubrics are not complete, but just to give you an idea. If we talk about allergies, we have mainly two types. We have the early type, which is IgE mediated. So we have quick reactions, instant reactions. So if the child is eating something, he will get within a few seconds or a minute, he will have reactions around the mouth. That we call um, clear allergy. It can happen with food, it can happen with drugs, and also with pollen. And what I also found out over the years, that here in Germany we have a lot of pollen. I'm living here in the countryside. We have a lot of nice flowers, nice trees, nice grass. And in certain months of the year, in the springtime, in the summertime, we have a lot of pollen. So also patients with eczema can aggravate with the eczema because of the pollen. So we have to adapt our potencies and our remedies. There's also a late type of allergies. It's triggered or it's carried out by the T lymphocytes. So here we have the reactions more after 2 or 3 days. You see pustules, nodules, we have a certain vasodilatation, and diseases like contact dermatitis is such a type. Contact dermatitis, like we use something, washing our hands, like a nurse in the hospital, all the days using the anti-infectious soaps. After times she can develop a contact dermatitis, and we have to treat this in another way. Okay, so something very important is, let's talk about the allergy tests. I have a lot of small children, babies, 1 year, 2 years, 3 years. And the parents like to know, oh, my child has an allergy, it has eczema. What will be the allergen? And they want to test. But I can tell you, in the first 3 years of life, these allergy tests in the blood are not valuable. They're not specific. And the main way to find out is to give the food or to let the food away. Or we also have possibilities with certain energetic measures, but the blood tests are not valuable before 4 years. So very important, the allergen is not the cause of the disease. The disease is miasmatic in the body, and it's responding to certain triggers from the outside world. So we have to treat the inner disease and the miasm to be able to cure that vulnerability or susceptibility for that kind of skin problems. So a German doctor, I know him, I didn't know him very well. He passed away 20 years ago, but he said skin diseases rarely have an external cause. The appearance of the skin is a visible reflection of the internal pathological change. So, what's the causa of the eczemas? It's multifactorial. It can be the environment, toxins, it can be nutrition, also wheat, sugar, milk products, it can be genetic, and it also can be emotional. The genetic part is not very small. So if I get a child in my clinic who has 2 parents also suffering from allergic disposition, it will be more difficult to treat. It's more miasmatic involvement in that cases. So one very important part of my treatment of skin diseases is the use of LM potencies. I already gave a presentation about that topic. And what I like is because the eczemas have the tendency to go up and down and up and down. So if we give C30, for instance, we have to wait 2 or 3 weeks. We see aggravations, or it's more difficult to be able to see early whether the remedy is right or not. With LM potencies, and I developed a certain method how to use them, I can see within 1 week whether the remedy is right or not. And so the big advantage is we have little first reactions, little side effects, and also with other patients with chronic diseases, with severe autoimmune diseases, other chronic diseases who have to take allopathic drugs, we can administer the LM potency at the same time, which with my patients is a big, big advantage. So how is that special order to treat with LM potencies? So I use a bottle of 30 milliliters. I don't use alcohol because I have these little children. And in light, I put some globules of the LM potency inside, and I fill it with water. I leave a bit on the top, a free space, so if you shake, it can move. And in light cases, I would give 5 drops daily. In medium cases, I would give twice 5 drops daily. And in severe cases, I would give twice 10 drops daily. I will present some cases later, and you will be able to follow that way. I will explain it with the cases. And I let this therapy I will give for 1 week without break. Because in that 1 week you could have ups and downs. No, 1 week. And if you don't see a positive effect after 1 week, you can change the remedy. It's not working well. If the remedy is working well after 1 week, you will see an amelioration, and you can continue for some time with the remedy. So if it's get better, stay with the remedy. That's clear. As long as the patient is improving. Don't give it for 4, 5, 6 weeks. No, you give it until he's better. And if there's another reaction coming, or we have to reduce or make a pause. That's very important. Okay. So C potencies we also use in chronic cases, and as we know, we have to wait. If it's not acute but chronic, we have to wait for C30 4 weeks and for C200 6 weeks. Okay, first case, 9-month-old boy with eczema. Case history. So this is a boy. You see the spots on his arm. And case history. With 4 months, he had a vaccination of diphtheria, tetanus, polio, and HIV. In short time later, he developed an eczema at the left arm where he had been vaccinated. So you see these spots, which are unusual. They don't look like a normal eczema. So we have eczema with red spots on the arm, face also bent of the knees. It is a very friendly child. He likes a lot of attention. He likes very much skin contact with the mother. So this will be a case for you interesting also. In the beginning, it was difficult for me until I found the right remedy. So I had the with the children, sometimes they don't have so much symptoms. So also the emotional part is important. So because of the friendliness and he likes contact with the body, I gave phosphor C30, later phosphor C200, and we saw some ups and downs. But now it's getting worse again after 2 months of treatment. Okay. So I said everything started after the vaccination. I gave 2 yards C30. There was a little aggravation for 3 days, which could be a good sign, and was better for 3 weeks. But now relapsing again. Okay. So I decided to give sulfur because there was not a clear reaction, and it was after the vaccination. But the mother already is very unhappy because it's going up and down. So also the sulfur, no clear effect. So I said to myself, it seems that there's a blockage. And I went to the repertory. If you look in Murphy's repertory, skin eruptions after vaccination, we see Metzerium, Sarsaparilla, Silicea, Etuja. And he had some symptoms. He had skin eruptions after vaccinations. He had skin itching at night. And he also had diarrhea. So we have the repertorization is a bit too big here, but we see the first remedy going through these 3 rubrics is Metzerium. So I gave Metzerium C30 a single dose. And 3 weeks later, he was much better, less itching, less diarrhea. So 5 weeks later, he's very good. 8 weeks after a single dose of Metzerium C30. With 1 dose, he was developing very well. So you see the pictures here. The arm is much better. The boy. But now he needs another vaccination, and the parents want to give. So I said, let's see what's going to happen. And in the beginning, it was okay after the vaccination, but after 3 weeks, again, the skin was starting. So we gave another dose of Metzerium C30, and everything went well. So here's a boy a bit later. He's happy, no skin eruptions. Conclusion. Sometimes we need more time. The vaccination can act like a blockage. And there are more remedies for post-vaccination than Tuya. In this case, it was Metzerium. And I will have some more cases for you about that remedy because it's a very, very precious remedy. I use it often in my clinic. So, conclusion, after the right remedies, the recuperation was quick and without that kind of waves. So we see here we have the right remedy. Before it was going up and down, it was not a clear effect. Interesting that the eczema started at the point of inoculation, also very special. And that spot-like eruptions seem to be typical for Metzerium. I saw that more often. So, second case, the 6-month-old boy, very, very strong eruptions in the face after a vaccination also, here on the body. So the history is like this. 7 weeks ago, this boy had a vaccination, and a day later, strong biting behavior. So there was something. And a week after the vaccination, first eruption started, which later become moist and thick. So this child had to go to the hospital and got antibiotics intravenous. Back home again, he aggravated another time. So homeopathic treatment of my colleague was giving with Tuya and sulfur 3 times a day. And after this, we saw that big aggravation. So the boy comes like this to my clinic. family history. The mother had asthma, bronchial polynosis. And during pregnancy with this child, she had a lot of skin eruptions all over the body. So we can say that this baby inside already had this genetic disposition of skin eruptions, which was transmitted to the mother in the pregnancy. The father had asthma, so from both lines we have a problem. So when the skin problem started with the boy, it started with an urticaria. And he had very, very cold hands. So if we see skin eruptions after vaccinations, we always say that rubric, hands icy cold, we have Thuja, Silicea, and Metzerium. In skin urticaria, we also have these three remedies, Metzerium, Silicea, Thuja. Here, and if we take also eruptions crusty and moist, we also see wood remedies. First Metzerium, Silicea, sulfur, Thuja. And I did choose Metzerium in this case because the crusts were so special. And this kind of crusts and moist skin is indicating for Metzerium. So I gave a low potency in that time, D12, 3 times daily. 4 days later, the skin is improving, the hands are warmer. And 12 days later, the skin is good. I don't have a photo here because the mother came from far away and she gave me a phone call. And in that time, there was no handies to transmit the photos digitally. So, but she phoned me, she said everything is good. Next case, 13-year-old girl with impetigo contagiosa. So what happened? She was using warm water damp to clean her skin with her fingers. 13-year-old, she wanted to be pretty and got that infection of the skin. We call this impetigo contagiosa. Also on the side, and it is around the eyes, and this is a bit dangerous. So, impetigo contagiosa, a bacterial infection of the skin. Treatment: Metzerium C30 1 dose. Next day, the skin seems a bit calmer, no eruptions. Okay. So no more eruptions. The process stopped after one day. Of course, the skin eruption cannot go away within 1 day. Okay, the eyes are more or less. So I said, now we dilute Metzerium C30 and give it twice a day. So 7 days later, the skin is much better and we see a pretty face. So if we talk about the remedy Metzerium, it's a polycrest. You have a lot of symptoms of the skin, of the membranes, of the bones, of the nerves. We have violent pains, and very typical is the aggravation at night. Because of these kind of symptoms, it's also called the herbal mercury. So if we talk about the skin eruptions, we have violent itching, worse at night, worse warm air or the warmth of bed, and very typical, that's the keynote for Metzerium concerning the skin eruptions. It's yellow, moist discharges. And after this, they will form brownish hard crusts. So the skin eruptions are alternating with asthma. Metzerium also is a very, very good remedy for neuralgic pains, especially after eruptions of zoster in the face. And during the COVID pandemic, a lot of people developed these eruptions in the face, these herpetic eruptions in the face, due to the infection or due to the vaccination. And if they stayed a long-going pain, so here Metzerium is the remedy number one. Also, we can have neuralgic pains of the teeth at night. Tearing pains at night in the long bones, that's also very typical, the problem in the bones. So this is a syphilitic remedy. And also interesting, if the skin eruptions are suppressed, it can cause deafness. So last case, a bit longer case, we have a burning of the skin. So that little girl, the mother was cooking a tea and had hot water, boiling water with the tea, and was walking through the room, and the little girl was playing in the ground, and the mother nearly fell, and the hot water was over the head and over the arm. So it was a big burn. They went to the hospital in Switzerland, in Zurich, and later it got infected, and they said to the mother, now you have to come again to the hospital. We will give antibiotics intravenous, and we will try with an operation to remove the crusts. But the mother did not want this, and she came to me. So this is a 2-year-old girl. Okay. So half a year ago, the accident was an accident with boiling water. That means she has a problem on the hair since half a year. She was hospitalized to remove the crusts. And she developed fever, became antibiotics. And since 2 months, the situation is now stable but not improving. No fever. She has this thick crust with yellow discharge, and parents want to avoid a second operation. So that is not easy. You see these really thick, yellowish, brownish crusts, and beneath there's also a kind of bleeding. So I started with Metzerium as a remedy and with LM potency 10 drops daily. So next day the discharge was better. 3 days later, there had been a bit of discharge, and now it's getting dry. So it does not seem so bad. The first week was quite good. So I said, let's go on with LM potency 10 drops daily. 1 week later, more discharge. So I said, no, we make a pause after 2 weeks. Okay. But after 1 week, it was more or less the same. So I decided to give Metzerium C30 to have more a clear picture. But now she was developing fever. So we were in a difficult situation. All these crusts, all these pus, and now the girl developing fever. So I said to myself, now we have to change the approach. And now we have to look more for a constitutional remedy, also to treat the fever. And what are the symptoms? More discharge. She's getting pustules on the body. Hands and neck are more sweating. She's a lean person and has a very good memory for details, picks up little things. So I decided to give Silicea C30 twice a day, diluted, as a constitutional remedy. 3 days later, the fever is better, the hospitals, and she did not have to go to the hospital for antibiotics. So it was a good success for that child. But now the child is better, and now the hospital wants to operate against the crusts, and the mother said no. So we stayed with the remedy, and I gave Silicea C200. 10 days later, the girl is good, the general health is good, the crusts are more dry, less discharge. So these are good indications now. In the following months, she received Silicea 200 and Silicea 1M with good effect. So the crusts are less. Here's a grandmother, are less. The child is healthy, getting better, getting better. Months later, they have a control in the hospital. Now they want to remove the crust, always want to operate. So in the following weeks, the situation was stable, but not improving anymore with Silicea. We are more or less half a year now after, or 5 months after the beginning of the treatment. Of course, it's a slow process, but it's stable, it's not moving anymore with Silicea. So many these big crust. So I said to myself, perhaps I have to change the remedy. And the child is well. It's not developed other problems with the skin. Just the last piece of the crust is not removing. And so it's a very local process, what Dr. Hahnemann called one-sided disease. So I decided to give a local remedy for that skin crusts. And the main remedy is, once again, here, one-sided disease in paragraph 173. Dr. Hahnemann is talking about the difficulty to treat these conditions because we don't have so many symptoms. Okay, so I decided to give another time Metzreum after more or less three months of having given Silicea and a clear dose, Metzreum C200. So what happened? 2 months later, there was a short and strong discharge. And now it's much better. The child is happy. Now we see the crusts are much better. Here she is with her sister. And but we will not expect that the hair will grow in that place. We will not expect that. So she's developing well. This is the part of the scalp. And many years later, she's a beautiful woman with nice hair and still having that part of her scalp, but it's very well covered by the hair. Very beautiful young woman. She now also has 2 children. So conclusion, we have a one-sided disease. We have a local remedy. First we gave the constitutional remedy, and then the local remedy again. So if we treat patients with skin disorders, we really need patience and stability, especially also with the allergic conditions, because if we jump too much with the remedies, we will be lost. So no quick changes of the remedies. That's very, very important. And yes, that was it for today. Thank you for your attention. And I'm open for your questions. Just a second.
Yes, Shalu.
We have got a wonderful session from Dr. Beatrix. This is our question answer session. If you have any doubts about this session, you can hand raise and ask. We will be unmute you.
Yes. Yes.
Dr. Hariharan.
No.
Hello.
You have to unmute. You have to
You
unmute.
you are
I
unmute.
don't hear you.
Unmute.
Okay.
Hariharan sir, you are unmute. You are mute now.
Now it is okay. Is it
Yes,
okay?
yes. Now
Okay.
you're okay.
Okay. Good
Yes,
evening.
yes, yes.
Good evening, Dr. Beatrix.
Good evening.
Not only wishing, I like to congratulate you
Thank you.
because nice presentation and the correct way of homeopathic prescription. For that, I am appreciating you. See, I like to add one more thing. See, last time I got a case of pneumonia.
Yes.
Right lower lobe pneumonia. But actually, the patient is having severe chill and very high temperature. And suddenly, I took the X-ray and I find out that right side of lower lobe is affected by pneumonia.
Yes.
Then I inquired about the facts. Why it happened? Because that patient is very close to me, and she was having atopic dermatitis for the last 45 years. See, and she is taking homeopathic medicine only, but it is not cured properly. Finally, that patient, what happened is, she approached a vasculologist and he applied cortisone. And within 3 days, it is completely cured. Not cured, but it is completely, say, dry, and the patient is happy and everybody is happy. What happened is, after 3 weeks, she became asthmatic, high dyspnea, and the severe chill. And she approached me, and I took the X-ray and find out that right lower lobe is affected by pneumonia. Suddenly, the patient is admitted to the medical college, and they started antibiotic, and they told me that medicine is not responding. The patient is going to a dangerous condition. What I did is, I gave 1 dose of Sorinum 1 because I know that patient is highly chilly. He can't even dip his hand in cold water. Such a way she was chilly. That I know very well. See, the third day, the pulmonologist told me that medicine is responding well. I like to say the fact is that is the obstruction to cure.
Yes.
Is the
Yes.
miasm. That is the miasm. That miasm is obstructing that patient to antibiotic is not acted well. See, I like to say in allopathic treatment also there is obstruction. That time they will say the medicine is not acting, and gradually the patient is go to death. So, while we are treating, if a patient goes to an allopathic medical college, see, when they say that the medicine is not acting, see, we must give the exact if we give exact homeopathic medicine, the patient will survive and the medicine will also respond.
So I like to hear also your case and your story, because sometimes we have to combine allopathic medicine with homeopathic medicine. This
Correct.
is also a high developed difficulty. Really, if we can combine in the sense of the patient, this is very, very important. And here in Germany, we are all allopathic doctors. I'm an allopathic doctor by education. Yes.
Very good.
And what we try is to, and that's my daily work, the patients come with allopathic medicine or with cortisone for the skin or with even severe drugs. And they wish that we can reduce their drugs. They have less side effects, or the drugs with high blood pressure. So I have all these allopathic patients in my practice trying to treat. And really, for me here in Germany, it's very, very nice to have these LM potencies because you can combine so much at the same time. They can take a spray and you give the remedy, and if it's working, they can leave the allopathic drugs. And very nice
correct.
to hear from you. You gave Psoriasis 1M, and later the antibiotics were helping for the pneumonia.
Okay. Within
understand
5
why.
days, the patient
Yeah.
is discharged from the medical college. Now she is okay.
Very interesting, your
But-
story.
But another thing happened is, now the patient is started itching of her leg, and I told her, let wait. We can see what will happen. Let wait.
Yes.
That is now the patient, the leg is itching. That on the part is cured. That injured part, but that is the eruption part. There
Yes.
is
Now,
now it is
in that moment, now you have to be very careful not to suppress again. That's very, very important.
never
Explain
not
the patient very well.
Yeah.
Yeah, that's true.
Okay.
May I ask, where are you practicing in India?
Yes, I am practicing India in Kerala.
And where? Which part?
Kerala at Ambalappuzha, Alappuzha district.
In Kerala also. You have very
Alappuzha.
good colleagues in Kerala. I can see that. Next week there will be a big conference of Kerala of public health care and homeopathy next week.
Yes.
At the
In India, see,
yeah.
most flourishing state is Kerala. Homeopathy flourishing state is Kerala. A lot of homeopaths are judicially practicing at Kerala.
Very good, very good. So if you like to join, I will talk next week on Sunday in the morning.
Okay,
Also about babies and skin eruptions. So it was a pleasure to meet you. Thank you very much.
Okay, doctor. See, while I heard your hearing your lecture, the exact way you have treated that 4 cases, you have exactly way you have treated. And now I am very happy. Now I am very happy to see all these cases. Thank you, Beatrix. Come again with the new cases. Okay.
Yes.
Thank you, Harihar and Doctor. Is there anybody
Yes,
here to ask any doubts? The next doctor.
yes.
Dr. Shalu, we don't see you. Dr. Shalu, please show your face. This is more nice. Thank you.
Yes.
Okay. Thank you, Dr. Beatrice. It's really another big session. I must say, in that sense that your cases were brilliant, and you show how the beauty of homeopathy through your presentations. All the evidence were with you, and why you prescribe all these remedies, and when an obstruction was there, you were able to remove that, in the sense that you took the case again and find out another remedy that was quite suitable for him. And for that lady, and not only that, you observe what is happening to the lady even after years, and that's why you have shown the beauty of that lady in this last presentation also. That is the thing, that once you are able to cure with a homeopathic drug, definitely it will be a permanent cure. That's what is Hahnemann defined as a cure, that is a permanent cure. And you are able to achieve that in this case. And because even Cilicia, after that Mysterium, worked wonderfully. But from the very outlook, from the very outlook itself, the picture is an indication of Mysterium.
Yes. You can see it with the eyes. Yeah.
Thick leathery crystals, like things, scales there in the head, and we at several times we were able to achieve this target by using this mycelium in that typical skin diseases. And there are many cases where these asthma, as Dr. Hari himself told, that these asthma and these skin eruptions are alternating one another, as well as running together also. Because people are not aware of these things. They think that these are two phases of two diseases, but they never know that this is the same thing of the coin. Both sides of the coin is one is skin eruption, the other is asthma. So both are the same thing, just like a coin, and we need to give the right remedy to clear both of them thing together. We never try to suppress one another. That's the thing we as homeopaths has to do here. And congratulations once again. We we hope some more brilliant cases will come in the next presentation also. Anyway, welcome to Kerala. But unfortunately, I am also in Alapi, but I have a family similar function in Calicut on that day. So I have to leave. I cannot, even though I have registered for the same. Anyway, to see you. And otherwise, I would have attended the same.
Yes,
Thank you.
yes.
Thank you. Welcome to Kerala. Okay.
I will be online. I will be talking from Germany. Okay. I will not be there. Yes. Always a pleasure, Dr. Daniel. Thank you.
Thank you. Yes. If anyone want to speak, you may please raise your hand so that. Yes, Hari.
Doctor, see, one of my doubt. See, what about the action of graphitis in your experience?
Also very good. Good question. Good question. You know, if we have these little babies, and it's difficult to differentiate between. Normally, I say we have a calcarea baby or a sulfur baby or phosphorus baby. They behave in a different form. If they have just a few weeks, you have also to look in the eyes, how is the impression, how is the action. And if I'm not sure, I tend with the babies to give graphitis as a very good remedy. They have, for graphitis, typically, they are not very thin, they're a bit more, have more flesh, and the eruptions are red, but a light red. Light. They are not very dark red. And the itching is not very, very strong. It's more a toric remedy. It's not a syphilitic remedy, graphitis. And I see very good effects.
See, if
And
otherwise,
you know, one important point also, Dr. Haraban, I'm careful with sulfur.
correct.
Because,
That is the point. That is the point.
yes, yes, because
Graphitis,
we have a lot of beginners. That's a skin eruption. We give sulfur, give sulfur. No, I'm very careful
very
to
careful.
give.
Must be very careful. See,
Yes,
graphitis.
yes.
If the dose is much more, severe aggravation will happen.
That's the point. That's the point. So I give LM doses every day for a few days, and let's see.
Let's
I
see.
don't give 30. Yeah, very, very.
30.
Yes,
See,
very helpful.
I will give only one dose, sometimes in 14 days. Only give
30.
one dose.
See 30?
Then after watching, only another dose. Another dose. Such a severe aggravation will have the graphitis.
We have to be very careful with sulfur. With calcarea is no problem. With phosphorus no problem. But with sulfur,
the same thing like sulfur. Sulfur will I will give only 30 one dose.
Yes. Yeah. And be careful. Be careful.
Be careful.
And if sulfur is not working, it could be medurinum.
Medurinum.
Yeah. They are very also similar.
Okay, Serna.
Want to speak.
Thank you, Dr. Dhaneji, and congratulations, Dr. Beatrix, Madam, and good evening, everyone. Very nice presentation. select remedy, beautiful select remedy, Majorinum. One-sided disease. Majorinum is a very good remedy. Head eczema, you see. So, very, very
Thank you.
thanks. और डॉक्टर कल्याण स्वरूप जो है स्पीच डॉक्टर कल्याण स्वरूप प्रेजेंट डिजायर to speak. Thank you very, very thanks.
Thank you very much also. Dr. Danish, if we have 1 minute,
Yes.
I could also give you some information about Germany. Do you remember there was an article, they said homeopathy will be banned
Yes.
in February. So we
Yes.
had that petition, we went to the parliament with a good result. And now, because we will have new elections in Germany, you know, that Minister of Health was so terrible and the whole party was difficult. Now in Germany, we will have elections before the time because of all that kind of government. So one thing is clear, nobody will touch homeopathy, nobody. So
Thank you, Dr.
Yes.
Thank you.
yes, we are happy.
Dr. Salu, Dr. Kalyan Singh can be called for auto thanks also, sir can speak also.
Hello, am I audible?
Yes.
Yes, you're audible.
Many thanks to Dr. Beatrix and all together. One thing I want to say you, if you are going to treat any chronic disease and where there is suppression of the skin disease, until and unless the skin disease break out, you cannot cure a single chronic case. Must be break out the skin disease. Then you can
You're
get
right.
success in the homeopathic treatment.
Yes.
So where there is suppression of a skin disease must be come out. Thank you, Beatrix.
Thank you very much. Yes, that's true.
Yeah, and one
Yes.
medicine is very important medicine in a skin disease, especially eczema, is Dalkamara.
Yeah, very good. But you know, the good point is, if you give an remedy for the chronic disease, and normally, if the skin is coming out again, but with that remedy, which is a curing remedy, it will not be that bad. It will not be terrible. It will be bit until the patient is cured. That's my experience. Do you agree?
Thank you. Okay, time is over. Going to time be over.
An announcement, Shalu. That is, tomorrow we will have a session from Dr. Ami C. Shah, and she will be talking about magnesium group of medicines in homeopathy.
Interesting.
Okay. Then thank you, Dr. Beatrix. It's a very interesting session. You shared a lot of information on the topic of homeopathic treatment of skin disorders. We understood that you have been able to help many people and child. May you be able to work even more efficiently in your field of work. We hope you come again this platform in future. Now we want to wind up this session. And our Malayalam session will be started. I hand over the session to our respected Dr. Sri Manoj. Thank you all.
Okay.
Dr. P. Shaila